message come up. And I'll start our little intro slideshow as Stephen finds his way back to it. There he is. I channeled that. Like, I'm going to say his name and he's going to find his way.
Perfect timing. He's coming in.
Coming in. All right. All right. So here. Can you see that change of screen okay? Excellent. So thank you once again for joining us this afternoon. Thank you for agreeing to recording this session. So we'll let you know in the Poplar community when this gets posted on our YouTube channel. You're welcome to share with family and friends as well. Welcome, welcome. So we'd like to acknowledge that we are on the lands of the Coast Salish people. This is where we work, live, and play. And for Tina and I, this is in Vancouver, so we are on the lands of the Musqueam, Squamish, and Tsleil-Waututh nations. So just taking a moment to reflect on the lands on which you're on this afternoon, and if you'd like, you can post it into the chat box, the lands on which you're on. We like to create a safe space with our chat and choose. We all come openly, willingly, wanting to learn more and find out more and share, what's worked for you and not worked for you on your lung health journey. So we really encourage everyone to share your thoughts, values, and opinions without fear of judgment. The information provided here is for educational purposes only and does not substitute any professional medical advice you've gotten from your healthcare providers. We tend to get off topic as we do. We get good conversations going, and that's okay. If we're off topic for a little too long, Tina or I will nudge us back into the conversation. At the end of our time together, we will let you know when we've got about 5 minutes left, and we'll officially close things off. But we'll keep the Zoom open for an extra 5 minutes at the end for any other pressing questions before we go. So in terms of free upcoming events to help you learn, move, and connect, we do have our inhaler workshop. This month, we're doing the InHub device. So this is on Thursday, October 24th at 1 p.m. And then we also have ongoing enrollments for our Harmonicas for Health and Happiness. And Santa's been sharing, she's already been working on some songs. So we've got lots of spaces left enrolling all the way to March. So contact us however you like, and we can get you enrolled in a welcome intake session. So without further ado, let's chat. And I'd like to introduce our host, who's specialized in this topic of the palliative care approach. Her name's Jen. Thank you so much for being with us, Jen. Jen's a respiratory therapist in interior health. She works as a community RT. And she became involved with palliative care through attending weekly rounds at her place of work. And she's been encouraged to participate in further palliative training, given her role working with those with chronic respiratory illnesses. She has a deepened understanding and appreciation of the palliative program and helps to facilitate the recognition of how important these programs are, as well as removing the stigma and changing the narrative around the term palliative. So without further ado, welcome, Jen. Thanks for being with us.
Oh, we've got you.
I'm gonna unmute myself. Hello, everybody. Happy day after Thanksgiving. Hope everybody had a lovely weekend and a nice Thanksgiving, and they were able to participate with time with the people that they are the most grateful and thankful for, whether that be through Zoom or face-to-face connections. So yeah, my name's Jen, and I'm a community respiratory therapist with Interior Health. I'm in the Trail Castlegar area in the Kootenays. And when I came into my role, I took over for somebody else who was really trying to cement herself in with palliative care because she felt like it was a really important part of this role. Because I work with a lot of people with life-limiting chronic illness, and to be able to be so entrenched with the palliative care team and everyone who has a passion for what it means to be living and living with or providing help and support to people who are living with life-limiting illness. It's good to kind of have that continuum of care where I am in the know and able to participate weekly or bi-weekly or bi-monthly with regards to a lot of the patients that I see in community as a respiratory therapist. And sometimes then I am able to know in advance whether or not things have changed for them with regards to symptoms, symptom management, or the progression or the trajectory of their disease process. So it's good to have that continuum and to have those conversations for people who have had changes to their health or their symptoms so that we can come together as a team and have those important discussions and brainstorm and determine what further referrals we can provide for our patients themselves or even support for their families. Because as we all know that symptom management can cause symptom burnout, and also caring management can cause burnout as well too for our loved ones, and we all need support. So that's a part of the palliative care approach that we're going to talk about today. And I wanted to just start with my favorite quote related to palliative care is that palliative care does not mean that you are actively dying. It more appropriately relates to the ability to live well and improving quality of life with a life-limiting disease. So it does actually provide you with more empowering tools to be able to really determine what your goals of care are by having those conversations with the people who are most involved in your care and the management of your care and your requirements and how to support you best, and making sure that the people who are involved in your care are actually providing your care with the understanding of what your goals are, because the only person who knows best how to manage what you need support with is you, right? Because we're all different. We're not a one size fits all. So introducing the notion of palliative care early in someone's life is thought to be really distressing for the people with the life-limiting disease that is like a new diagnosis, and it can be really distressing for their loved ones or their family members as well. And in saying that, can any of you, or do any of you, if you want to like raise your hand in the chat or on Zoom, does anybody want to offer any personal thoughts of why they think that the word palliative or the notion of palliative care could be distressing to someone with a life-limiting disease, or even how it affects you personally? Just want to open up the room to that.
Well, I could lead up by saying that, I was on death's door before I had a lung transplant a couple of years ago. And so actually I was just 5 days away from getting made. And I was in a palliative program, I guess, for about not very long, only about a week, maybe 10 days prior to. My condition changed pretty radically and quickly because of a fungal infection in my lungs. And things changed pretty quick. And so but the so for me, I mean, I was kind of prepared. I kind of knew what this was about, and I was really personally, I was quite thankful that someone was prepared to talk with me about some of the issues that were coming up, because things were, even prior to getting the fungal infection. I mean, my lung condition and breathing were end stage, and so
Right.
it was important to feel that I could get some, and my wife as well, who is my caregiver. It was important for her to have some support in and know that there was someone there.
For sure. That's wonderful that you had that support.
Yeah, it was quite excellent. I mean, there was a doctor and I guess and a nurse that sort of came to the home, and we kind of reviewed our situation. But not only then, but it was afterwards. That as my condition, just rapidly degenerated to a point where, I was having major crises, and like significant stuff that occurred, and then eventually, within a matter of days, hospitalized.
For sure.
Yeah.
Well, thanks.
Yeah, it was good. It was good to.
Thank you for sharing that, Ken. Does anyone else have any thoughts that they want to share with regards to why it could feel distressing to hear the word palliative for the first time? Connie, I see you have your hand up.
Yeah, I think that, immediately you think that when someone says palliative, it means death.
Right.
That's what people think.
Yeah.
And if it, when it's explained that it could involve living more comfortably with a more chronic type of disease, that's very helpful.
Yeah.
But interestingly enough, I'm in Vancouver, and Ken, I think, is on the island, right?
Right.
And I did not have a positive experience of the palliative care team.
Okay.
So it was very difficult for me.
Yeah.
And I'm not using that team now.
Yeah. Did you end up getting a different team management, or?
No, I just I'm going with the home care nurses.
Okay.
They're very
Yeah.
serious.
Yeah.
I certainly can't see them as often as I would like.
Yeah.
But they're one of them has been really, really helpful, and
That's awesome.
also,
Yeah, I'm glad you were able to at least figure out what was going to work best for you.
yeah, I mean, there's still a lot of things I need to know, still a lot of problems I have, and I can see from the way that other people look on the screen that I'm worse than nobody else has oxygen on even.
Yeah. I mean,
I can hardly breathe.
Yeah. Yes. And it, again, like I was talking about earlier, it having a life-limiting disease, whether that be COPD, if we're talking respiratory, whether that be lung cancer, whether that be, interstitial lung disease, there are different needs for different people at different times. And also having oxygen may not necessarily mean that your condition is worse than your next door neighbor who might have the same, but your needs are different, right? You require something different to have a better or improved quality of life. And so, Connie, thank you again for sharing. You really did hit the nail on the head in that a lot of people associate the word palliative care, with the word death or dying, and think, and unfortunately, a really big proponent of why that has come to be is because of the language that's used oftentimes around palliative. So part of that would be, saying you know, is that patient palliative, or does that person need palliative benefits? Or when you have healthcare providers that are using the word palliative to describe active dying or active death, or that death is imminent, that's kind of what we're all used to hearing. You know, or my patient's not palliative yet, or there's nothing else we can do, so you are now palliative. Do you want active care or palliative care? So unfortunately, this language that has been used for a very, very, very long time has been the thing that has caused the stigma around the word palliative. And so the palliative care approach that healthcare providers and the government have really been working towards changing the language so that we can change the scope and debunk the stigma and the fear regarding palliative or palliative care, and replacing those emotions with more emotions of an understanding or an education perspective, and providing people with hope, right? So that because you can be palliative or be receiving a palliative care approach for months or even years. And it doesn't mean that you are end of life at that period of time. And being end of life, or being in a position where your health is end of life, or you're at that point in your trajectory of your disease process, things can change and shift. And like what Ken was explaining, and it was something that I was going to touch on in my talk as well, is that we can, having the palliative care approach be used to navigate your disease process or your trajectory early, meaning from the point of diagnosis of whatever your disease diagnosis is very important, because then we understand what we have access to. We understand the services and the healthcare practitioners that we have access to, and how we can all work together as a team to ensure that we are honoring your goals of care, because your goals of care should be outlined in terms of how you would like to see things as things do progress, or if and when they do progress. But they can change. So you can be going along and living your day to day and not really feeling like you have a lot of symptom burden. And then all of a sudden, like with Ken, having a fungal infection changed everything for him, and it took him from one end of the spectrum to the other. And he was faced then with, you know, making decisions that perhaps, you know, we need to make when we are more end of life. So I'll just so yeah, healthcare providers have changed our vocabulary, or we've been working towards changing our vocabulary, from asking, is this patient palliative, to would this patient benefit from a palliative care approach? And so a palliative approach to care is really meant for people who are living with an advancing illness for many years and experiencing changes in your health that require you to, oh, I'm sorry, I am getting ahead of myself. I missed something here. My apologies. Hang on 1 second. Okay. All right. The palliative approach to care is, I'm just going to take one moment.
Take your time.
My apologies.
You know what?
I completely deleted a part of my talk that was meant to come first, and here I am talking about the next stages. Okay, so as I had said, when is the best time to utilize the palliative approach to care? And essentially it is at the stage of diagnosis. And the reason for this is because introducing it early can actually decrease anxiety, depression, and increase hope and in some circumstances, increase life expectancy. It's an approach that improves and maintains best quality of life for patients and their families facing problems associated with life-threatening illness. So I just wanted to share a video, if that's okay, of it's called Better Early Than Late. And so instead of better late than never. And so I'm just gonna share my screen so that I can share that with you all. And it basically talks about the benefits of introducing palliative approach and palliative approach to care earlier in someone's diagnoses versus waiting till end of life, because that's not necessarily when we're going to have the greatest benefits to having access to everybody who's involved in the palliative approach for your care. So I will share
Jenny,
this.
just a quick question while
Yeah.
we're right there.
Mhm.
Is like really? I mean, people could because I'm involved with a support group. There are
Mhm.
many people that I work with, and from what I'm hearing, you're saying that someone can is eligible for intervention early upon diagnosis or sometime afterwards. Is that, am I hearing that correct?
And so that was definitely some more clarification that I was gonna provide as we were like navigating through this. And so there are different stages related to the palliative continuum, right? And so differentiating between the different stages of the continuum and understanding it can be really, really important, because the palliative approach to care versus palliative care versus end of life care are very different things, and they come on a different spectrum. And so there are palliative benefits, which is definitely something that you had access to, given the fact that you were at that point where you were going to access MAID and be able, you know, to do that. And there are different points in our disease trajectory where we have access to certain palliative benefits versus we all have access to the palliative approach to care, and ensuring that we have the right conversations with our healthcare providers to ensure what our goals of care are, and ensuring then that we have access to care that is provided to you with a palliative approach. And that means in being more active or thinking about the things and the people involved already in your access to care. So when you go for respiratory appointments and you have spirometries, or you have home oxygen assessments, when you see, you know, if you choose to see naturopaths or you're seeing a nurse practitioner, all of the people who are cared, even, you know, spiritual care, social workers, all of those people can be a part of a palliative team, and therefore be able to ensure that the right referrals are happening for you to be able to access the things that you need to access. So palliative approach to care is making sure that all of the people who are involved in your care are navigating themselves along with you to ensure that you have an improved quality of life alongside the treatment process, right? And making sure that your symptoms are being managed appropriately, and that all of the things that are, and all of the people that you are involved with as it relates to your health and your symptoms are approaching it from symptom management, helping with symptom burden, and making sure that your quality of life is the top priority. And having those conversations as it relates to what your goals of care are going to help those people understand what quality of life means for you, because it's different from person to person. So The video I'm about to share is more about the palliative approach to care and why having that palliative approach conversation early in the diagnosis is really important versus waiting until someone is end of life or in a position in their disease trajectory where you're all of a sudden having those conversations. Because at that point in time, it can sometimes be too late for the patient or their family to be able to receive the supports that they need to ensure that their quality of life is being adhered to, right? And so making sure that we know what systems we have access to early versus waiting until the end to have these conversations. So that's basically what I mean by that, because palliative care and end of life care are very different than what you have access to or what you're trying to access when you do get your diagnosis. Does that make sense, Ken? Yeah, okay. All right, I'm gonna share my screen. Here we go. Okay.
Is there audio, Jen?
There is. There we go. I'm going to start it over.
Yeah, just
All
click
right.
share audio when you watch it. Just do you have to stop screen share.
Okay. Hang on one second.
Should be at the top or bottom of your screen. There should be a end screen share.
Oh, here we go. Stop share. Okay.
And then hit the share again, but don't pick the tab yet.
Okay.
And in the bottom left, there's a checkbox that says share audio.
Bottom left. Oh, here we go. Share sound. All right.
What comes to your mind when you hear or see the word palliative? Many people, appropriately, think of words such as compassion, dignity, or quality of life. However, for many people, what comes immediately to mind are the words dying, terminal, and end of life. Unfortunately, too few people think of palliative care alongside treatments to control the disease.
I'm Dr. Gordon Giddings. I'm a palliative physician at the University of Ottawa and clinical content editor of Pallium Canada. The aim of this Pallium Doodle is to explain that palliative care is not something for just the last days or weeks of life, but should be initiated much earlier.
To better understand this, let's look at the illness trajectory, starting at the time of diagnosis of a life-threatening illness. In some cases, the disease, whether it be cancer or another non-cancer disease, can be cured with treatments. In other cases, however, the disease may be incurable. Let's draw a graph around this journey. On the x-axis is the length of that journey from diagnosis to death. On the y-axis is the goals of care, the treatment and care options in focus. Now, unfortunately, because people often think of palliative care only for the last days or weeks of life, they will only activate a palliative care approach in the last days or weeks of life. Let's look at the negative consequences of this. They include lack of symptom control with unnecessary suffering, inappropriate treatment choices, prolonged psychological distress because no one is addressing the fears and concerns of the patient, lack of discussions about prognosis, or lack of preparation regarding care choices and treatment goals. So what do we need to do? Well, we need to erase the old model of palliative care and use a different model, a different approach. What if we start palliating early in the illness? This does not mean that treatments to control or cure the disease and palliation and supportive care are mutually exclusive. The model of early palliative care is much more patient-centered and responsive to patient needs. Is there evidence to show that early palliative care is better than late palliative care? In a large US-based study by Timmel and colleagues, the model of early palliative care was compared to the usual or common model of palliative care, only in the late phase of disease. What do you think the results were? Which group do you think did better? Which group had less depression and less anxiety? Which group had better quality of life and symptom control throughout their illness? Which group do you think lived longer? The early palliative care group experienced significantly less depression and anxiety, better quality of life, better symptom control, and astoundingly, they lived almost 3 months longer than those patients who received only late palliative care. So the key message is palliative care early is better than palliative care late.
Does anyone have any questions about that video or any comments, any thoughts?
Too late now.
Never too late. What do you mean by that, Connie?
I would have liked to have done that when I was diagnosed.
Yeah, but at any point of the trajectory of where you're at, you can have access to that. And if there are certain proponents or individuals that you don't gel with and it's not implementing or improving your quality of life, then ensuring that you advocate for yourself or ask for help with regards to having access or referrals to the people who can help you with your
Right. It's a lot of work.
It can be, especially if you don't have the people involved in your care that can do some of that legwork for you, you know? What makes it feel like a lot of work for you?
Well, I think that, the difficulty is that what I'm looking for, might not be available. And, I just keep trying and trying and trying. And so, over years, it's very tiring because I'm really tired all the time now.
Yeah. And
other people try to help me, but it's even harder for them because they don't completely understand what's going on with me.
right. And you have, do you have a family doctor?
Yes.
Okay. And what other types of healthcare practitioners are involved in your care?
Everybody. Some of them I've even had to drop because I have too many.
Right.
I'm a social worker, so
yeah,
I know how to make my team.
Right.
But I need, and plus I don't think I should be having to do it for myself. But
yeah, I mean,
and
yeah,
and just certainly I would have liked to have had a lot of the services when I was first diagnosed.
Right.
And I'm as everybody notices, when I'm in a group with them, unfortunately, I'm quite resentful.
Okay. Yeah, I mean, that's hard. It's hard to have those feelings and feel as though what you were needing was looked over at a point when you felt like you needed it the most. But
and COVID was another big thing.
For sure. And living with chronic disease and illness during COVID made living with chronic disease a lot more isolating.
PGH stopped providing rehab.
Yeah.
So right at the moment when
I
would have started that.
Yeah. I think everywhere stopped providing rehab, unfortunately.
Falls didn't, and I was
Okay,
on a wait list for them for a very
okay. Yeah, I
of
think
course,
wherever there were virtual rehab programs already being offered was definitely easier for those people to continue.
it's just that, long wait
Mhm.
lists,
Yeah,
a lot of difficulty. Yeah, just generally. Yeah.
yeah,
Certainly my family doctor got me a new specialist.
that's good.
But
Mm-hmm.
this- it's a lot. You can only see the specialist every few months anyway,
Right.
and so by the time you see them a few times,
Mm-hmm.
years gone by, at least.
Yeah. The thing with the palliative program or the and knowing that there are rounds, at least in British Columbia, that occur, and they occur very differently depending on the region that you're in. There is usually a internal medicine doctor or a physician that is in the center of those rounds, that attend rounds, along with spiritual care, hospice, usually one of the community paramedics, home care nurses that have patients that they work with that are part of the palliative benefits program, and other healthcare practitioners like myself as a respiratory therapist. And so when we come together once a week or once every 2 weeks to rounds, we're able to bring patients forward, whether they are receiving palliative benefits or not. And if we think that somebody that we work with would really benefit from the palliative approach to care, we can bring them forward and we can still have those conversations, especially when the people who are involved in our palliative rounds have the ability to do referrals and give people greater access to.
I don't want to take up all the time because I have a tendency.
Yeah, that's okay. This is
But what I wanted to say was, I don't understand what you're saying.
okay.
I don't understand what rounds might mean to you, because
Yeah,
mean to me that people, get together or go around and see virtually or otherwise the
right.
patient. And
So
I have never heard of any such thing.
yeah, so it's often something that happens in the background that patients themselves aren't aware of. And so that's why I'm bringing this to the table today as part of our discussion. Rounds is when a group of healthcare professionals that are part of a palliative approach team, we get together virtually and we have discussions based on people who are receiving palliative benefits, are part of the palliative care program, but within that scope, we can bring other people forward who we feel might benefit from referrals that we can submit to other people within that palliative care team to make sure that we're advocating for those patients and possibly getting them the ability to see other healthcare professionals through the referral process. And so by understanding what the palliative care approach is, it means that all of the healthcare professionals that you're already working with, you can have those discussions and at the same time understand that you have access to the ability to receive referrals for other healthcare that may be beneficial to improving your quality of life. And so that's what rounds is. It's not that we're going around to other people's homes. We're having these discussions as healthcare professionals to determine how we can best serve the patients that we serve in community.
It's more like a plan of care meeting than rounds.
It's not a plan of care because we're not necessarily planning out people's care.
Right. You're not
That's right. That's right.
Yeah, I would like to suggest that other people have a chance to talk.
Yeah, for sure. And what I'm saying is applicable to the group, as you know, as opposed to I'm wanting to answer your question and honor that, but it is applicable to everybody who is here, and it's information that's going to benefit everybody, right? Because we all have different questions and things that, you know, that are going to be more helpful to us versus others, right? And so I wanted to, you know, honor what you brought to the table for sure, and what your questions were. And so with does anybody else? Yeah, go ahead.
Seems like Stephen has had his hand up. Go
Okay,
ahead.
yes. Sorry, I can't see everybody on my screen. Thank you. Go ahead, Stephen.
Oh, we lost your audio, Stephen.
Do you have those headphones plugged in? Yeah. You gotta unplug it from the computer. Oh. And then hit the unmute button, and I think we'll be good to go. Try saying something? Nope.
Are you still on your phone, Stephen?
No, he's on the
No,
computer.
that came on.
You had it with them with the headphones.
Sorry.
before.
Oh, there you go. Bravo!
I took them out of my ears, but I didn't unplug it. Okay. So I'm a single person. I have no family. And I actually have I have a circle of people in my life, but really I only have a very few number of people. I'm fortunate that the closest friend is a nurse, and now he's 70, I'm 78, and I call him my guardian angel. And whenever I go to a doctor, he always comes with me. He takes all the notes. I don't have to worry about it. And I also have completed a representation agreement. I have people who are, you know, member powers of attorney, whether health or money or whatever. And so that's all I kind of thought about. I experienced my mother's palliative care, but I have never heard anything about, you know, as I deteriorate. I mean, I'm presuming I'll deteriorate. I have two potentially terminal diseases. One is COPD and the other is cancer, which I just was diagnosed in May. And I've just started some treatment. You know, so, you know, I'm certainly not on my first leg. I'm somewhere else down the chute. But so I hear you talking about this stuff, but I don't even know what palliative programs are, I mean, or where they are available. How do you access them? Does someone have to refer you? I don't know any of that stuff. And so before you know, unless I put my hand up to the right person, nothing's going to happen. You know,
Right.
and I look forward as I get older. Should I, you know, last longer? You know, it's going to be hard for me to, you know, to look after myself.
Right.
So yeah, that's kind of my long roundabout question, you know.
Yeah. And so the palliative approach to care, if I can, you know, try to I'm having word finding problems today. Apparently my long weekend is like impacting my ability to think today. But with the palliative approach to care, it's literally for any person living with an incurable illness, and that they may benefit from a palliative approach to care that really is about aiming to provide provide comfort and improve quality of life through whole person-centered care. So as opposed to just dealing with what your disease or your diagnosis is, it's more about helping you with symptom management and doing and referring you to all things, healthcare providers, and things in community that can help you improve your quality of life. So whether that be symptom burden, symptom management, psychological or, spiritual care, improving our spiritual health, our emotions. So it's dealing with the person as a whole, as opposed to just what the diagnosis is, what the disease is, and making sure that we're addressing and managing patients and families, psychological, practical, social, physical, pain management, symptom management. And so we're helping to assist with those things at the same time that the person is experiencing their disease process. Where that changes, go ahead, Stephen.
You've explained that, and it sees, how do I access that? Who do I talk to? Where do I go? How do I access? I mean, I have a great GP, so the scope of what you're explaining, I understand, but I just don't get, like, how do I sign up? Basically, is the question. How do I sign up?
So,
and
the palliative care,
the same,
for sure.
Sorry,
A
Connie,
palliative care approach isn't necessarily something that you sign up for. Have you had those conversations with your GP?
No.
So that's
because I didn't know the place. I thought, okay, well, if I'm on my deathbed, that's palliative.
That's right. And sadly and unfortunately, and that's why we're having this discussion today, and we're definitely gonna, have many opportunities to have more discussion about this and expand on it. But having that conversation with your GP is the number one place. And if to have those initial discussions and just saying, I have this life-limiting illness or disease, I have, multiple different scenarios that are causing, me to not have the best quality of life. I learned today, or I had information today about the palliative care approach. Can we have a discussion about that and what's involved in all of that? Because that's the starting basis to putting you on that roadmap or that trajectory to increasing the level of support that you get as your disease progresses, like what Ken was sharing today, whereas, he didn't really have, he went from a place of not having symptom burden and having to manage that, first the diagnosis, symptoms changing, and then all of a sudden an unexpected thing changing that changed where he was finding himself. And then now he's in a different part of it as well too. So things can change within a disease process. We are given, a life-limiting diagnosis, but things move along in that. And what we have access to, so, when somebody partakes or is approved for palliative benefits, let's say, so let's just say that we go from having the palliative care approach where we know that all of our healthcare providers are part of the process of ensuring that they are helping to improve our quality of life. Where that changes is when your illness changes to the point where your abilities change or your disability within your illness worsens. And so we have access at that point to these benefits. But starting these conversations early is what is necessary to ensuring that before it's too late, you are on this continuum path of receiving the palliative care approach and receiving the benefits and the support that you need, and your healthcare providers all ensuring that when you're ready to receive palliative benefits, that gets taken care of well before end of life. But it's starting early, it's starting at diagnosis, understanding what you have access to and what your goals of care are. So goals of care is another conversation to be having with your GP, so that if you're needing to be brought forward to a palliative team of specialists, we can do that before you're all of a sudden in hospital and you haven't had any of these conversations. Does that make sense?
So, Stephen, a lot of this, like this palliative care approach is a big initiative amongst healthcare providers for us to get educated to be able to help guide you, as Jen's been saying. And so what we're going to do at Poplar is we're going to work with Jen to put up a resource page in the Poplar community, kind of highlighting, because it kind of depends on where you live and which health authority you're under as well. So Jen's offered that having the first discussion with your GP is a really good place to start. But a lot of these palliative care programs, you can sort of try and get referred to through central intake through your health authority. So often if you go to your health authority website and type in the search field, central intake, these are sort of your outpatient way into programs. So you could type in, you would get a phone number once you do that, and you could call that central intake phone number, talk to a nurse and say, listen, I'd like to know what's open to me in terms of palliative care and things like that. So there is still a lot of sussing out the terminology, and a little bit of like when we're saying, you know, advocate for yourself, really it's just asking for you to have this holistic approach to your care under the palliative care approach. And then, as Jen was saying, when you go along the trajectory and you're getting a little bit more to end of life care, then things open up for you like palliative benefits, which could cover the cost of medications, a palliative care doctor, which might be able to work with different kinds of medications to help your shortness of breath, like opioids, for example. And then perhaps as you go along the trajectory, maybe hospice care and things like that. So we're going to try and sort that out a little bit further in our resource page, but these are really, really great questions. And Alan had a question, and then Ken. And we're just at 3 o'clock now, but anyone that wants to stay on, because this is a really good conversation, really great questions, we're going to keep going for a little bit, if that's okay, Jen. Just a little bit longer, but if you have to sneak out, feel free.
I know. I'm going to check and see if my 3 o'clock patient is here, and I may have to scoot out. I know, unfortunately, we got started a little bit late, and also then I felt like I threw myself a curveball by having deleted my information on the palliative care approach. I just want everyone to know this is my first time doing my own specific talk about this. And so just trying to organize my thoughts, and I apologize if if things didn't really seem streamlined to you today. Like Jenna was saying, I'm going to put a resource page together, and this is just, this is just day one of starting this conversation. And really it was more about, helping you all to understand that, that sometimes thinking about the word palliative can be really scary. And there are a lot of people that come to these talks and these chats that we have that feel like, ooh, I think I want to X-nay myself from this conversation. And it's because of the stigma that comes along with the word palliative and palliative care, because our access to that word has usually come with an understanding that someone is dying or about to die, or they're at end of life. And we're just really wanting to introduce this palliative care approach to you all as a starting point here today, so that we understand that we can start today to, you know, feel more educated or have more education, so that we understand what supports we do have as you guys do go through the trajectory of your disease process, and knowing that they can change from day to day, just like what Ken was saying, with what happened with his particular life situation. And, you know, thankfully he had his lung transplant, and things are in a much better, stable place for him currently. And so it's just knowing that we have the ability to have these conversations with our GPs, with our nurse practitioners, so that we can start our own initiative and have that autonomy for ourselves to make sure that, you know, whatever our goals of care are for us, which are very independent to and unique to each and every one of you, that the people who we are involved with as it relates to our health and our symptom management and tests, that we are all kind of brought onto the same page. And then eventually making sure that our family is all brought onto the same page as well too, because it is a newer initiative. It is something that has been occurring for some time, but there's a lag. And so now we're playing that catch up, because we may come in contact with certain healthcare practitioners who, you know, are talking about this palliative care approach, but not providing the education to their patients and their families about what that means. And then next thing you know, loved ones think that their family member is on the, you know, on death's doorstep, whereas they may not necessarily mean that at all, but because the word palliative has been mentioned or stated, that's where we end up. And so it's basically about providing education today and starting the conversation. And we're definitely going to have more conversations about this. And this is an opportunity for you to go have some conversations with your loved ones or with each other amongst yourselves, or even, you know, with Jenna and Tina, and have these conversations, or take a look at your healthcare authority's main website and do a little bit of reading and investigation for yourself, so that when we do come back together and we talk about this more in depth, you can come with the questions, and hopefully we can help you navigate this together so that you feel supported. If that makes sense.
Okay.
Thanks so much, Jen, and thank you, everyone. Tina and I are welcome to stay on a little further to field some questions that some hands up that people had. Jen, thank you so much once again, and we'll let you know in the Poplar community when Jen's resource page is up and going. Anyone that would like to stay, hang on the line. Anyone that has to go, thank you so much for joining us today.
Yeah, Jenna and Tina, thanks so much for having me today, and hopefully we can come back together and provide some clarity.
Yeah, thanks so much,
Great.
Jen. That was fabulous. Yeah.
Okay. Bye, everybody.
Bye-bye, and thank you.
You're welcome.
Thank you. Alan, did you have a question? Maybe we'll start with you.
Kind of curious of how, like, up here, we're kind of in the middle of nowhere. How do we access some of these systems? Is there something going to be available in our area? Because it sounds like something I wouldn't mind getting involved with, but I don't want to get involved with it and then find out that I have to go from here to Kelowna every time I want a meeting, like I currently do now for any time I have a condition. You know, so if it's going to be local, great. But if it's not, I really don't feel like chasing all over the province to see these people. You know what I'm saying?
Yeah, that's super fair. And I agree, like some of the travel people out your way have to do just to get healthcare.
Well, it's 3.5 hours from here to Kelowna in good weather.
One way.
Ellen, could you? We never did the introduction, so I don't really know where you hang out.
Oh, I'm in Trail, BC.
Trail. Okay, so that's actually right where Jen is.
Is that where she's from? I missed that.
Yeah. She's so Jen and her group are right there in Trail.
Well, then
So you're sitting right on the doorstep of the presenter.
I'll have to figure out how to get a hold of them and find out how to get involved with it, because it's something that I would definitely be interested in. I got my my diagnosis just about a year ago, and Tina and Jenna and my RT up here, Kelly, have been teaching me everything I need, and they have been wonderful. But I feel that there's probably so much more that I'm missing because I don't know the questions to ask. And I would like to find some of that out and be able to go further than what I have been doing, and getting more involved.
Amazing. I love that. I love this. And you folks, I gotta say, you folks on this call are the ones that are very proactive with your own care more than most are. Even just asking those questions to your healthcare providers helps get you better care, I've got to say. And I think this is actually helping us to perhaps structure that palliative care resource for yourselves and other people in our community. Because we actually going into it, we're like, what do people want to know? And so we're hearing these same questions. How do I access this? You know, who are you going to call? And part of the thing, which I am totally seeing, there's this, the message that we're trying to say is like this palliative care approach thing is fabulous. You know, can be listened to and things you want become a priority. And part of that messaging really needs to land on the healthcare workers' ears as opposed to your ears. And so part of this message and part of there's organizations out there that are educating the healthcare workers about it. So if you are lucky enough to have a healthcare worker that has been introduced to this concept and who has that buy-in, it doesn't need to be labeled as palliative care approach. Like Jen was saying, it's a person-centered approach instead of a disease-centered approach.
When I first signed up to this, I wasn't sure if I was going to take it or not, because I had the same misunderstanding about palliative care. And I hate to tell you this, but I ain't nowhere near ready to die yet. There's a whole lot of fish out there I'm going to be harassing. And I want to keep going. So, you know, I figured, but now that I've heard what she's talking about, and this is a whole approach rather than a piecemeal approach. And I think I like that a whole lot better.
Yeah. And, you know, the healthcare, I think a shift in the healthcare system in the way it's designed and run needs to happen in order for that to happen just naturally and smoothly for everybody.
Don't get me going on
that. Yeah, me neither.
Yeah.
So right now, the way we're at with their healthcare system, it is a little bit piecemeal. There are, you know, specialists who look after each organ and whatever. I don't see that changing, but if they can all work together to work towards your goals, that's the idea. And you can play an important role in this. And so perhaps what we'll do as part of our palliative approach, sort of a toolkit for you or information, is if when you interact with your healthcare providers, you can convey to them what's important to you. And there does need to be some work on your part too, with certain healthcare providers to nail that down and know what language to use, know what terminology would mean something to your healthcare providers. You know, sometimes healthcare providers hear you complaining about certain symptoms and they just say, oh, okay, this is bothering them, but maybe they're not looking at the overall picture. So how can you put that overall picture and your overall goals into the mind of your current providers? So it's not necessarily changing the team, it's changing the team's approach to your care. So that's probably one thing that we're going to work on, is helping you to do that. The other thing is, yes, there are palliative care teams that you may want to access at some point during your journey. And if we can help you identify when that might be and what those teams can do, we'll try and have that laid out for you too.
Excellent.
Yeah.
Okay.
Great questions. I love this.
And I've got one more question for you, Ellen, because so I mean I had pulmonary fibrosis, and I'm wondering, is that what your condition is as well, or is it something different than that? Or it's just a matter of inquiry on my side.
I have COPD. I was a long haul truck driver for years, and the biggest threat to a truck driver's safety is the fact that we continually smoke all the time. And I mean, I smoked for 54 years and I quit.
Good for you. That's fabulous.
So now I'm paying the price for it.
Yeah.
But I think nobody but myself. So now I'm learning to deal with what I have left, and I've gone from being very active to kind of throttle the way back because I keep running out of breath. And
Right.
so there's nothing more limiting than knowing that if you're going down the middle of a river fly fishing, you're going to get about halfway down against the current and run out of breath and strength, and you're going to have to stop. That doesn't rest well with me. So I want to find out what I need that I can keep doing the things I love.
Okay. Well, thanks, Ellen. I really appreciate that.
Yeah.
The and back to Tina and Jenna too. I was, and it's great that I now have some sort of introductions to sort of pathway, because presently I'm working with a couple of people who are well advanced. I mean, in what's going on with their lives, and so and their health. And this, you know, they are way beyond the initial phases of this. They're really at end stages for both parties, and this is very helpful. Of course, it does change up from health authority to health authority. And I am kind of wondering how it is in the Coastal Health Authority. I mean, over here in Biha, I've kind of got a feeling for it, but I've also got people that I work with that are a part of Coastal, and I'm wondering what's going on there.
Yeah, Vancouver Coastal does have palliative care teams as well that people can be referred to. Yep. Did you have any specific questions about it, or?
Well, at this point, no, because at this point, you know, it's just trying to get this particular individual who really doesn't, you know, I'm not even going to begin some of the major challenges that are there. I mean, he just recently received his supplemental oxygen and a number of other things, but, you know, and a very well informed, educated, and himself was an advocate for people for many years, and just is needing some advocacy for himself at this moment. So I'm just trying to step in and provide some support to make sure that he gets the supports that he needs, because it seems like really he's you know, he's languishing, and it's taking a significant toll. Well, as it does. I mean, this illness and being so incredibly compromised takes such a toll, sort of personally on us. You know, as we're sort of letting stuff go and trying to adapt to new conditions and circumstances all the time.
Thanks, Ken. I'll just offer maybe one scenario we often taught when we teach this in pulmonary rehab. So one example is, if your goals of care as you go through your disease progression is, you know, you sort of decided for yourself that perhaps you're at the point where you might not want to go to emergency or an urgent care when you're having increased bouts of shortness of breath. Or you've decided for yourself, you know, that you may not be seeking certain active treatments, but should you have an infection or something like that, you would be open to antibiotics. Sometimes when you when you haven't had these conversations with your healthcare professional, such as your doctor, and you go to them with a situation that has changed suddenly for you, they might send you back to where you don't want to go. They might send you, well, go to emergency to get assessed or go. And where the difference is, if you're connected to a palliative care team or a palliative care doctor, their whole strategy is so client focused that they take a different approach with you. And they might say, okay, well, let's try these antibiotics to get through the infection. Let's try different medications, and a very common medication to treat shortness of breath when you're getting more to end stage lung disease or opioids, for example. Let's try a dose or adjust your dose so that we can keep the shortness of breath, for example, at bay. And these teams are so well versed in doing this, more than an emergency room doctor, more than your respirologist, more than your family doctor, that you often get the care that's more centered to you, that's more in line with your goals. And not many people know that these teams are out there and that you can access them. And accessing these teams, you can do yourself through your family doctor. And as I was mentioning earlier, you can contact through your health authority through their central intake and ask to get connected to teams like this. So that's kind of looking at kind of maybe just one of the spectrums. Jen showed us that timeline, and this was maybe near the end in one of those spectrums, but that's where the palliative care approach and then working with palliative care teams can align with what you want for yourself. And so this is the kinds of education that we're trying to get out there for you. Any questions around that idea, or kind of makes sense?
No, it makes a huge amount of sense, because in my experience, as I kind of watched as things went, and Connie, your point is well taken, where I see a specialist once every 6 months or 3 months maybe, but and my condition changes, every couple of weeks. It's just like, whoa, boy, how do I keep abreast of this, and some significant challenges. So yes, it would be welcome to have someone providing, taking a lead in communication and response. That would be very good.
Yeah, and I've been through all those things, and actually my referrals went fairly quickly, but the actual services,
the actual care,
were not as helpful as I would have hoped. And I think for me, what I wished, and I think it would be a good idea to ask those of us that are a little further down the line, what do we wish we had?
Right.
And maybe there's some way of persuading someone to have that, because the first thing I ever thought was, I wish someone could come over and see how I'm functioning and see if they can think of some different ways, like a respirologist or a respiratory therapist, to see how I'm breathing, because I very rarely have that desperate breathing. I mean, I'm not very happy and I am having trouble breathing, but I don't have that one where you are breathing but you don't feel it.
Right.
I had that at the beginning because I didn't know how to breathe. Right. And I would have liked, I understand that actually the home care nurses were talking about some kind of a program where a doctor comes over and tries to help you think of things you could do better for your day-to-day living. Because yes, there are lots of times in a day, pretty well every hour, I'd say, when I can't breathe. But there are also lots of times in a day when my other illnesses cause me more problems. And it would be nice not to have to focus on them.
Yeah.
It'd be nice to be, as you say, seen as a whole person.
Yeah.
And I don't, of course.
Yeah, I'm trying to think, that's where some of the the gaps, really present themselves. Like in certain areas, like Jen, she's a community respiratory therapist and can go into people's homes and maybe assess some of that to some degree. But in Vancouver, coastal, as an example, we don't have those community RTs. So those gaps are there. Yeah, and they're felt.
Well, I must say, when I finally got a home care nurse, and I don't know how I got that.
Yeah, right.
I was referred from here to here to here to here to here, and finally I got the home care nurses. And they actually, although they're not the tops on respiratory stuff, but they're so good on everything to help you function better.
Yeah.
And they also said I didn't have to see the palliative care team, the one that I wasn't getting along with.
Yeah. Great.
I could see them instead.
Yeah.
It's just that, of course, I can only see them every 2 weeks. So
yeah,
maybe I'll get to see them sooner if I act sicker.
That double-edged sword.
Yeah, it's tough. And the healthcare system, we get it, even from our side of things. It's confusing, can be difficult to navigate. So we'll try to put some resources together, and some resources, some suggestions, where can you go to start things, or how do you suggest things to your health team that you have? Advocate for yourself in a way that you might get a response. Yeah.
Thanks, Alan. So some of you have to go. That's okay. Why don't we take this moment to wrap up? We'll just offer that one other service we have at Poplar is our Poplar Clinic where we have respiratory therapists and certified respiratory educators that you can book a one-to-one with, and they can help you to kind of navigate with your own healthcare system some of these palliative approach strategies. And then we'll let you know when we get our resource page up and going. So thank you so much for attending today and for contributing and all you've had to say. We really value it so much. And we'll see you next time.
Thank you.
Great. I always tell everybody I don't know what I would have done without you guys. So.
Oh, thank you, Connie. Yeah, thank you.
Very supportive. Thank you.
Thank you.